Hi there, this is Cassie Cannon from Cannon Psychology, and today I wanted to talk to you about phase 4 of EMDR's 8 phases. So, phase 4 is called desensitization, and this is the phase that most people are thinking about when they hear about EMDR. So, quick recap: phase 1 is history taking and treatment planning, phase 2 is preparation. Phase 3 is assessment, which is where you're specifically activating the memory that we are working on. And then phase 4 is desensitization. And the purpose of desensitization is to allow your brain to take the memory and have another chance to work on it so that it can be stored in your brain in a way that's more healthy and has less energy behind it. So, how that works is once we've activated the memory using phase 3, then at this point you've got buzzers in your hands, or there's you're going to be doing eye movements or something of that sort, but there's going to be some form of stimulation allows you to have what's called dual attention, meaning that this stimulation allows you to know that I am still in the present, that this is the here and now, but my mind is working on something that's really traumatic that happened in the past. And the dual attention and the stimulation it's called bilateral stimulation. So your eyes will be going back and forth, or buzzers will be going back and forth in your hands. Some people use auditory, so you might have headphones and then there might be tones going back and forth. And so you're just going to let your mind wander while this stimulation is going on, kind of keeping you in the present. And at some point, I stop the stimulation and I say, take a breath, let it go. What do you notice right now? And your only job is to tell me right now in this moment what comes to your mind. And it can be an emotion, it can be a physical sensation, like if you're really tight right here, it can be a part that you're at in the memory, and it can be something that you're thinking about. And there's no right or wrong. Sometimes it's nothing, and if it's nothing, then tell me that it's nothing. Sometimes people feel like they need to come up with something to tell me, but all I'm looking for is the genuine truth of what's happening in the moment, because that lets me know where we're at. So sometimes if your mind has wandered to what you're doing later on today, then that gives me information and lets me know what to do next or what not to do next. So your only job is to just notice what's happening, let your mind wander. And some people with the memory, it just kind of bounces around in their mind from the beginning to the end to the middle. And some people go chronologically. Some people don't really go in the memory at all, and they just notice physical sensations, or they have thoughts about themselves or something of that nature. And remember, there's no right or wrong, so all you do is let your mind go where it wants to go. Now, if things are starting to get a little bit intense for you, we don't want things so intense that you feel even more traumatized. That's not what we want. And so if you're starting to get there, I always ask people to let me know, so that there are things that I can do to take the intensity down a little bit. But sometimes it goes there really fast. If that happens, give me a stop signal. Let me know that we gotta stop. And we will, because the purpose isn't to have you so activated that your brain can't continue to work on the memory if you're too activated. So ultimately, as you know, your mind is wandering and we're doing the bilateral stimulation and you're focused on this dual attention, at some point when I tell you, take a breath, let it go, what do you notice now? Ultimately, there's not going to be that much energy, if any. And when that happens, that's what we're looking for. And so once you are able to bring up the memory that we're working on, and there's very minimal, if any, emotional charge, a lot of people, most people, we can get it down to neutral charge, or like a sense of acceptance. Then we go to phase 5, which is actually my favorite phase, because we're actually now building in positive beliefs about yourself. So phase 4 is the phase where we're working on the trauma specifically. This phase completely depends on the person, but it can take 1 to 7 sessions to get through this phase. In my experience, on average, it's usually 2 sessions, sometimes 3. But if the memory we're working on has a lot of similar memories, then it might take a little bit longer. But once we're done with this phase, then we move on to I call it the feel goods phase, which is called installation, which is another video that you get to click on and listen to. Thanks.